Welcome to another episode from the Veterinary Medicine Digest. Today, we are conducting an extensive deep dive into a paradigm-shifting study that compares the recurrence of clinical signs in dogs treated for thoracolumbar, intervertebral disc herniation through two very different modalities, traditional surgical management and the emerging technique of multiple intradiscal injections of the enzyme known as chondroitinase ABC. To understand the weight of this comparison, we must first establish the historical and clinical landscape of intervertebral disc disease, a condition that has challenged veterinary neurologists for over a century. The clinical recognition of what we now call intervertebral disc extrusion began in the late 1800s with the work of Dexler, who described neoformations causing spinal cord compression in dogs. It was not until the middle of the 20th century that pathogenetic research by researchers like Olson and Hansen confirmed these neoformations were actually herniations of degenerate nucleus pulposus material through the annulus fibrosus. Hansen's landmark studies in the 1950s characterized the condition as a chondroid metaplasia that occurs predominantly in chondrodystrophic breeds, specifically highlighting the Dachshund, the Pekingese, and the French Bulldog as being at extreme risk. The anatomical and genetic basis for this susceptibility is profound. In chondrodystrophic dog breeds, the expression of a fibroblast growth factor 4 retrogene on chromosome 12 is responsible for dramatically accelerated intervertebral disc degeneration. This genetic insertion leads to early mineralization of the nucleus pulposus, which eventually fails as a shock absorber and extrudes into the vertebral canal, causing acute spinal cord compression and contusion. While this process occurs most frequently in the thoracolumbar region, particularly at the thoracolumbar junction involving the discs between the 13th thoracic and the first lumbar vertebrae, recent research has shown that the clinical presentation and anatomical distribution vary significantly between breeds. A multi-center retrospective observational study involving nearly 1,000 dogs demonstrated that while the thoracolumbar region remains the most common site of extrusion across the board, French Bulldogs have a significantly higher proportion of cervical intervertebral disc extrusions compared to Dachshunds, who almost exclusively suffer from thoracolumbar events. Furthermore, English Cocker Spaniels tend to present with extrusions at an older median age and show a higher proportion of lumbosacral disease compared to their smaller counterparts. The traditional standard of care for a non-ambulatory dog with acute thoracolumbar intervertebral disc extrusion is decompressive surgery, typically a hemilaminectomy or a mini-hemilaminectomy. This consensus has been built over 7 decades of surgical practice, starting with early techniques described in the 1950s. The logic is straightforward. If there is material compressing the spinal cord, that material should be removed to allow the neural tissue to heal. Historically, surgical outcomes have been reported as superior to conservative or medical management, particularly in dogs with severe neurological deficits. A recent systematic review and meta-analysis indicated that 93% of dogs that were non-ambulatory but retained deep pain perception recovered the ability to walk after surgery, whereas only 62% to 79% of similar dogs recovered with conservative therapy alone. However, this dogma is currently being challenged by new perspectives and data. Some researchers argue that the good outcomes seen after surgery may simply reflect the natural history of the condition rather than the intervention itself, noting that a large proportion of dogs recover even without surgical decompression. The debate surrounding the importance of spinal cord compression is fueled by findings that spontaneous decompression can occur. A prospective cohort study of 72 non-ambulatory dogs managed conservatively revealed that 96% of dogs with intact deep pain perception recovered ambulation without surgery. Perhaps more surprisingly, nearly half of the dogs that were deep pain negative also regained the ability to walk through conservative management alone. Magnetic resonance imaging conducted 12 weeks after the initial injury in these dogs showed a substantial reduction in the volume of the extruded material. In many cases, though the degree of resolution did not always correlate with the clinical outcome. This suggests that while compression is a major factor, the spinal cord possesses a remarkable capacity for recovery and neuroplasticity that might be underestimated in the surgical literature. One of the most persistent concerns for any owner of a dog with intervertebral disc disease is the risk of recurrence. Recurrence can occur early, within weeks of surgery, often involving further extrusion at the same site, or it can occur months or years later at a completely different disc space. To mitigate this risk, many surgeons perform prophylactic fenestration, which involves incising the annulus fibrosus and manually removing the degenerate nucleus pulposus from non-affected discs. The efficacy of this procedure is a topic of significant debate. While it is generally accepted that fenestration of the herniated disc space at the time of surgery minimizes the risk of early recurrence at that specific site, the benefit of multi-site prophylactic fenestration is less clear. A randomized controlled clinical trial demonstrated that multiple site fenestration from the 11th thoracic to the 4th lumbar vertebra significantly reduced the rate of first-time recurrence compared to single-site fenestration. Specifically, dogs treated with only one site of fenestration were 2.7 times more likely to experience a recurrence than those who underwent multiple site fenestration. Despite these findings, some clinicians worry about the potential for vertebral instability or iatrogenic nerve root damage, particularly when fenestrating caudal lumbar discs. In addition to manual fenestration, other prophylactic techniques have been explored, such as percutaneous laser disc ablation. This minimally invasive procedure uses a laser to ablate the nucleus pulposus, thereby theoretically reducing intradiscal pressure and the risk of future herniation. A large retrospective case series of 303 dogs followed for at least 3 years showed that only 3.6% of dogs experienced a recurrence confirmed by advanced imaging and surgery after receiving laser ablation. However, nearly 20% of owners reported some form of suspected recurrence or clinical signs, highlighting the difficulty in distinguishing true disc extrusion from other causes of spinal pain without definitive diagnostics. This brings us to the core of our deep dive, the use of chondroitinase ABC as a chemical alternative to traditional fenestration. Chondroitinase ABC is an enzyme that digests chondroitin sulfate proteoglycans within the nucleus pulposus. By breaking down these molecules, the enzyme effectively degrades the matrix of the disc, which could plausibly reduce its ability to herniate in the future. This chemical chemonucleolysis has been investigated as a therapy for acute intervertebral disc extrusion, with accumulating data suggesting that its associated recovery times and clinical outcomes are similar to those of decompressive surgery. The study we are focusing on today, published in April of 2026, aimed to specifically compare the owner-reported recurrence of clinical signs in dogs treated with intradiscal chondroitinase ABC injections versus those treated with routine surgical management. This was a pragmatic, retrospective matched cohort comparison study that included dogs that had recovered independent locomotion following an episode of acute non-ambulatory paraparesis or paraplegia. The methodology for this study was rigorous. The investigators identified 47 dogs treated with chondroitinase ABC and matched them with 79 surgical cases that had similar demographics and follow-up periods. To be included, all dogs must have recovered the ability to take at least 50 unsupported steps without falling. The chondroitinase ABC group received injections of 1.25 units of the enzyme into 4 consecutive intervertebral discs. These sites were selected based on the attending clinician's neurological and physical examination findings and were performed under fluoroscopic guidance. The surgical group consisted of dogs that had undergone traditional decompressive surgery, with a variable number of discs fenestrated as part of their routine care. Specifically, in the surgery group, 7 dogs had 0 fenestrations, 32 dogs had 1, 17 dogs had 2, and 20 dogs had 3. The primary outcome of interest was owner-reported recurrence of clinical signs suggestive of thoracolumbar disc herniation, such as spinal pain, wobbliness, or inability to use the legs. The researchers chose this owner-reported metric because it is of the highest practical value to clients, who primarily want to know if their dog will suffer from similar signs again, regardless of the definitive pathological cause. Furthermore, requiring imaging confirmation of every recurrence would introduce a significant selection bias, as not all owners can afford or are willing to pursue advanced diagnostics for a second or third episode. The follow-up was conducted by investigators who contacted owners via telephone or text, asking standardized questions about their dog's health since their initial recovery. The results of this comparison were striking. Recurrence of clinical signs occurred in 30% of the surgical dogs, representing 24 out of 79 cases. In contrast, only 13% of the chondroitinase ABC-treated dogs reported a recurrence, which accounted for 6 out of 47 cases. When the researchers applied a univariable Poisson regression to account for follow-up time and the possibility of multiple recurrences in a single dog, they found a significantly lower recurrence rate in the chondroitinase ABC group. The incidence rate ratio was 0.38, meaning the enzyme-treated dogs had a vastly reduced likelihood of seeing those clinical signs return. Interestingly, the analysis also revealed that older dogs had a lower risk of recurrence, with an incidence rate ratio of 0.81 for each additional year of age. When these variables were combined into an optimized multivariable model, the effect of chondroitinase ABC became even more pronounced. The injections were associated with an adjusted recurrence incidence rate reduction of approximately 70% when age was taken into account. To ensure the robustness of these findings, the investigators performed sensitivity analyses, removing dogs weighing more than 15 kilograms and dogs in the surgery group who had zero fenestrations. The results remained consistent across these subsets, implying that the beneficial effect of the enzyme was a real phenomenon rather than an artifact of the sample composition. There are several compelling explanations for why chondroitinase ABC injections might be so much more effective at preventing recurrence than routine surgery. First and foremost, these injections act as a form of chemical fenestration across multiple sites. In this study, every dog in the enzyme group had 4 discs treated. In the surgical group, the majority of dogs had 0 to 3 discs fenestrated. Therefore, the chondroitinase ABC dogs received a more widespread prophylactic treatment than is typically applied in a standard surgical setting. The enzyme effectively digests the proteoglycans that allow the nucleus pulposus to hold water and maintain its volume, essentially deflating the disc and removing the material that would otherwise have the potential to herniate. A second possible explanation involves the nature of the surgical procedure itself. Traditional decompressive surgery is inherently traumatic to the surrounding tissues. It involves the disruption of the epaxial musculature and can result in substantial paravertebral scarring. Furthermore, the common post-operative recommendation of 6 to 8 weeks of strict cage rest may lead to muscle atrophy and a loss of vertebral stability. It is possible that these factors actually promote future episodes of recurrence or spinal pain through mechanisms related to structural instability. In contrast, the percutaneous injection of chondroitinase ABC is minimally invasive and does not require the same degree of tissue disruption or prolonged immobilization. We must also consider the role of subclinical pain and inflammation. A significant number of owners in the percutaneous laser disc ablation study reported a dramatic improvement in their dog's attitude and demeanor immediately following the procedure, suggesting that many of these dogs may have been living with chronic, low-grade back pain that was not clinically obvious until it was relieved by the reduction in intradiscal pressure. Similarly, the widespread digestion of disc proteoglycans by chondroitinase ABC might provide a similar relief across multiple vertebral segments, leading to a more comfortable and active dog that is less prone to showing clinical signs that an owner would interpret as a recurrence. However, the researchers were careful to acknowledge the limitations of their work. One major factor is recall bias, as owners were asked to remember events that may have occurred years prior. While the investigators matched the follow-up periods between the two groups to minimize systematic differences in recall, the risk remains that owners might not accurately remember every minor episode of pain or wobbliness. Additionally, the lack of confirmatory imaging for the recurrences means we cannot be certain that every episode reported by an owner was truly a new intervertebral disc herniation. Some signs might have been related to other orthopedic or neurological issues. That said, for the person at the other end of the leash, the clinical signs are what matter most, and the study clearly shows that the enzyme treatment results in a dog that is less likely to exhibit those concerning behaviors. Another vital consideration in the management of intervertebral disc disease is the cost and accessibility of treatment. The high cost of decompressive surgery often places owners in a difficult position, sometimes leading to the selection of euthanasia for a dog that might have a good prognosis for recovery. The development of a minimally invasive, effective, and potentially more affordable alternative, like chondroitinase ABC injections, could drastically improve the welfare of thousands of dogs whose owners cannot afford a multi-thousand-dollar surgical procedure. If a percutaneous injection can provide similar recovery outcomes and even better long-term prophylaxis than surgery, it would represent a massive step forward for the field. The broader context of these findings includes the evolving understanding of how we manage acute spinal cord injury in general. For decades, the focus has been almost entirely on the mechanical compression. Yet we know that the contusion, or the primary impact, initiates a cascade of secondary injury mechanisms including oxidative stress, inflammation, and ischemia. Traditional surgery does little to address these secondary factors. The ACVIM consensus statement notes that there is currently a lack of high-level evidence for most aspects of intervertebral disc disease management, including the ideal timing for surgery and the use of neuroprotective drugs. The fact that chondroitinase ABC may provide a similar or superior clinical result suggests that we need to broaden our therapeutic focus beyond just the removal of compressive material. The discussion around recurrence also forces us to look at our definition of success. In many surgical studies, a successful outcome is defined simply as the return of independent ambulation. However, for an owner, a dog that walks but lives in chronic pain or suffers from repeated episodes of debilitating injury is not a complete success. The fact that chondroitinase ABC injections reduce the rate of reported clinical signs by 70% suggests that this treatment may be providing a more comprehensive form of long-term stability and comfort for these patients. We must also touch on the secondary outcome of the laser ablation study, which showed that over 90% of owners were highly satisfied with that minimally invasive procedure, even if definitive diagnostics were not always performed for suspected recurrences. This high level of client satisfaction reflects a growing preference for less invasive options that carry lower risks of surgical complications. Routine surgery, while generally safe, still carries risks of vertebral sinus hemorrhage, aspiration pneumonia, and accidental damage to the spinal cord or nerve roots. Minimally invasive injections naturally avoid many of these major surgical pitfalls. As we synthesize all of this information, it becomes clear that we are at a crossroads in veterinary neurology. The historical dogma of immediate surgical decompression is being countered by data, showing the success of conservative management and the prophylactic potential of chemical interventions. The study comparing chondroitinase ABC to routine surgery provides some of the strongest evidence to date that our standard approach to the at-risk discs may be less than optimal. If we can achieve a 70% reduction in the recurrence of clinical signs through a series of injections, we have to ask why we aren't using this technique as a primary tool more often. The implications for veterinary practice are significant. Clinicians may soon be able to offer a truly effective prophylactic treatment at the time of the first disc event that far exceeds offered by manual fenestration issues. Furthermore, for dogs that are not candidates for surgery due to comorbidities or financial constraints, these injections offer a powerful alternative that could preserve the human-animal bond and save countless lives. It also points to a future where we might use such injections as a primary treatment for the initial herniation, assuming further studies continue to show that locomotor recovery is comparable to surgery. We must continue to push for prospective, randomized, and ideally blinded clinical trials to further validate these findings. The low quality of evidence currently available for many of our most common procedures is a hurdle we must overcome to provide the best possible care for our patients. This latest study on chondroitinase ABC is a major contribution to that effort, providing a clear signal that there is a better way to manage the long-term health of the chondrodystrophic spine. In summary, the transition from Drexler's 18th century neoformations to the 21st century chemical chemonucleolysis represents a remarkable journey of scientific discovery. We have moved from a purely descriptive understanding of paralysis to a highly technical and increasingly biological approach to treatment. The finding that chondroitinase ABC injections into 4 consecutive discs can reduce the recurrence of owner-reported clinical signs by 70%, compared to surgery, is a powerful testament to the potential of these new modalities. It challenges us to rethink our reliance on the scalpel and to consider the biochemical environment of the intervertebral disc as the next great frontier in veterinary spinal medicine. As we look toward the next decade, we can expect to see these techniques refined and expanded, potentially becoming a routine part of the management plan for every Dachshund, French Bulldog, and English Cocker Spaniel that enters our clinics. The history of this disease is a history of consensus and controversy, of dogma and discovery. From the early debates over whether these were neoformations or herniations, to the current debate over whether decompression is overvalued, the field has always been characterized by a drive to improve the lives of our canine companions. This latest deep dive into chondroitinase ABC versus surgery shows us that there is still so much to learn, and that our current standards are often just a starting point for future innovation. We owe it to our patients and their owners to stay critical, Stay curious, and always look for the most effective and least invasive ways to keep them walking and pain-free. Thank you for listening. The titles for the reference papers are in the video description. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.